Hi, my name is Dr. Sebastian. Today I want to talk about the most common problems dentures have when they break. The first most common problem is when a patient loses a single tooth or multiple teeth. This usually is a pretty simple problem if the patient brings in their old tooth, and if the tooth is in good shape, it's a simple repair that can be done in the office. If the tooth is not good, then we have to order some new teeth, or if I have one on stock, I will just select a new tooth to replace the denture. That's the most common problem. The second most common problem is when the denture literally splits in half. This happens a lot of times when the patient will drop the denture, or the bite or the denture is not stable, and the denture will literally break in the mouth. So when that happens, if the denture cannot be repositioned correctly, a new impression will have to be taken in the mouth, then the denture can be repaired. This is actually something that I made to help repair a denture, and this would be the type of model that we would have to make in the lab to repair the denture. So I'm going to show you how I do it here at the office. If I have time, I'll do my own repairs. If I don't have time and I don't have the materials needed, I will send the denture out to the lab. So the next step is I'm going to show you how I use the acrylic here in the office, and then I will show you how to finish the denture. Remember, this took me years to learn how to do. Okay, next I just want to continue and show you how the denture repair would be done. First of all, I have to grind the denture so the material will flow in there, and I want you to make sure that, or I make sure that the denture is positioned correctly, and there's actually acrylic that's been ground away so the material can flow into. The same thing here with the tooth repair, is that the acrylic has to have a place to flow into, and we have to make sure that the tooth that we're going to replace fits perfectly in there. So I'm going to start mixing my materials. I'm going to show you how it's done. I'm going to start right now. Watch my repair turn out great, especially when it's on TV. Now my denture is already positioned on here, and I just want to make sure that it doesn't move, and my acrylic will fill all the little cracks and crevices. Okay, now I'm going to do both repairs at one time. Okay, so the next thing I wanted to show you, this next step, is that my material has been sitting for at least 20 minutes, and now this is really hard and really rough. So if you could, I don't know if you can see how rough this is, this denture. This is pretty rough right here, and also this repair is really rough, and it's rough on the inside too, with a lot of excess because the material had to flow in all the little cracks. So what I got to do now is I have to pry this off the model so I can polish everything up, and you can see how my whole denture now is stuck together. It's all one piece again, and now I got to polish and trim it up. We're getting close to the end. I just wanted to show you our final results. This has taken me less than an hour. This is the original denture that had the broken tooth. Looks pretty good. This is the denture that was cracked in half. That also looks good. Okay. Well, I just wanted to say goodbye and let you know that occasionally I will send the denture out if I don't have the time to do it. But sometimes I can do it here in the office within the hour, 60 minutes. So good luck, and talk to you later. Bye.